Good morning, Sunrisers. I'm Dr. Karen Emerson, and today I have with me my technician, Skylar, and this is Navy Seal. Navy Seal is a 14-week-old border collie that is actually being trained to be a search and rescue dog. Well, a few weeks ago, her owner presented with the Navy Seal, and Navy Seal had actually been bitten in the face by a snake. Now, we don't think it was a rattlesnake, but we do think it was probably either a copperhead or a moccasin because the face did swell up. We did have to do blood work, do antibiotics, and this baby was just in her yard. So the owner had actually noted that there were some snake activity in her yard. So what I want to talk about today is the rattlesnake vaccine. This is a vaccine that we offer that is only $15, and it actually will protect your dogs against the rattlesnake venom and also give some protection against the copperhead and moccasin venom so that your pets will be able to make it to an emergency facility and not die. Normally with a rattlesnake bite, pets die almost immediately depending on the size of the rattlesnake. So anyway, everything went really well. We're actually going to start the rattlesnake vaccine in a few months because when your pet gets bitten by a snake, they cannot have the rattlesnake vaccine for 4 months till 4 months later. I actually also have another dog here that presented yesterday that actually was bitten by a snake also. So this is actually Sarge. He's a 2-year-old American Bulldog. Pit bull dog, and he actually presented yesterday with a leg 3 times the size of what it is today. He was actually bitten on the face by a snake, and he was bitten on the leg back here by a snake. This is where the big snake bit him, and his whole leg and foot were 3 times this size yesterday. Of course, we placed an IV, started IV antibiotics. He was actually, I think, just right outside the yard. So we are going to have a lot of snake activity this summer. So just bring your pets in and get that rattlesnake vaccine. You have to end up getting 2 doses, but it's very, very inexpensive. And if this would have been a rattlesnake, Sarge probably would not be with us here today. And the owners have seen rattlesnakes in the area. I'm thinking this was probably a moccasin bite. Which is Sarge is very lucky, but he is going to have to be in hospital for the next few days on a severe, IV antibiotics, IV fluids until we get him back to normal. So if you have a dog or you live in an area, even a residential area, come by, get that rattlesnake vaccine. I promise your pets will thank you.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.